Hello, my name is Rfouda. I'm a senior athletic training student at Florida Gulf Coast University, and today I'm going to be demonstrating how to conduct a cranial nerve assessment. The first nerve is the olfactory nerve, which is smell. So I'm going to use an alcohol prep pad. Open it, go ahead and close your eyes. And I'm just going to put it underneath their nose. Can you smell that?
Yes.
Okay, so if they couldn't smell it, that would indicate that there's an issue with that nerve. The optic nerve, which is the second nerve, is vision. Is to test their vision if they can read things. So, for example, I'm going to look over at that sign over there, and can you read what it says at the top?
The skeletal system.
Okay, he did not get that 100% correct, so that would indicate there could be something wrong with that. The oculomotor nerve is the third nerve. The eye movement and papillary reflection. You could test how their eye moves, and also I'm going to be using how their pupils react to light. So what you can do is cover one eye, look straight ahead, see if the pupils react, which they did, and if they didn't react correctly, like if they didn't constrict or dilate when the light was on their eye or not, and if they did not react equally, that would indicate something's wrong with the nerve. Trochlear nerve, which is eye movement. So I'm going to have you follow my finger. I'm just going to move it side to side, and what I should have said before too is make sure that they don't move their head, and he did, and the eyes had fluent movement when he was following my finger. So that was a good test with that. Any indications, like I said, not being able to follow the eye or my finger smoothly would have been a indication something was wrong with that nerve. Trigeminal, which is face sensation and mastication. So go ahead and clench your teeth. Okay, and close your eyes. Do you feel that?
Yes.
Which side is it on?
Left.
Okay, feel that?
Right.
Okay, so he was able to correctly say which side of the face, and he was able to clench his teeth, so that would indicate the nerve is good there. If he had any issues clenching his teeth or saying which side of his face, like I was touching, that would be an indication something was wrong with that nerve. The abducens nerve is next, which is eye movement, and which is abducting the eye past midline. So I'm going to kind of follow my finger and don't move your head. Here, and then I could also go through like a star pattern. So here, 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 and he did well with that. If his head moved or his eye could not follow it very smoothly, that would indicate a positive test that something is wrong with the nerve. The facial nerve is next, which is facial muscles and taste. So if I had something I could see if he could taste things, or I could have him go ahead, close your eyes, smile, frown, okay, raise your eyebrows. So he could do that. That's another thing to test for the nerve. He was able to do that, so that says the nerve is good. If you had any issues with that, that would indicate there's something wrong. The vestibulocochlear, which is hearing and balance. So go ahead and close your eyes. Which side is that on?
Left.
Is that on?
Right. Right.
Okay, so he was able to correctly tell which side it was on, and then there was also the balance aspect. So I could have him stand up and close your eyes, and then balance on one leg. Okay, and since he was able to do that, it indicates nothing was wrong with the nerve there. Have any issues with balance or hearing indicates something was wrong. The glossopharyngeal, which is swallow, voice, or gag reflex. One thing you can do is go ahead and swallow, and then if you can look, and if you can't necessarily tell, you can put your hand on their neck and go ahead and swallow again. Okay, so since you could feel the muscles moving, that's indicating that he was okay. If he had any issues with that, then that would indicate there was something wrong with that nerve. The vagus nerve, so it's pretty much the same type of test you could do for glossopharyngeal, which is like swallow and like saying gag reflex. So go ahead and open your mouth, stick out your tongue, and say Okay, and there you go. That's indicating that the nerve is good. If he wasn't able to do any of that, that would indicate a issue with that nerve. Spinal accessory, which is sternocleidomastoid trapezius. So go ahead and shrug your shoulders. Okay. And go ahead and look to your left. Look to your right. Okay, that's all good. If he couldn't move his head as much one way or another, or if his shoulders did not shrug the same, that would indicate there's something wrong with that. And the last nerve is the hypoglossal, which is tongue movement. So go ahead and stick out your tongue, go up, down, left, right. Okay, since he can move his tongue, that's indicating the nerve is okay. If he wasn't able to do that, that would indicate that there was something wrong with that nerve. But that's all for the cranial nerve assessment. Thank you for watching.